is Dr. Nandini Gulati from the Fortis Hospital, Vasant Kunj. So, thank you, doctor, for joining in. And over to you, ma'am. This will start with the session now.
Hi, thank you for the opportunity. I am Dr. Nandini Gulati. I'm working as a senior consultant in pulmonology, critical care, and sleep medicine at Fortis Hospital, Vasant Kunj and Gurgaon. So I'm a pulmonologist, and pulmonologists are basically dealing with your lungs health. So today I'm going to talk about tips, tricks, how to keep your lungs healthy, what are the common lung conditions, how you can make a preventive lifestyle to keep your lungs healthy till the long time. So most of the patients which come to us are with cough. So they say my cough doesn't go. Now what to do? So they are here with us because of cough and they need the reason why they have this cough and the treatment for that. This cough can arise from various areas of your respiratory tract, starting from the larynx, the supralaryngeal area, which is just under your neck, the trachea, bronchi, which are your windpipes, the ear canals, eardrums, pleura pericardium, which is the covering of your lungs, your esophagus and stomach can even cause cough, a chronic cough. So what are the triggers of this cough? Maybe cold, heat, chemicals like acid reflux, pollution, smoke, touch, all this can trigger your cough. What are the common conditions which cause cough and respiratory problems? First and foremost are upper and lower respiratory tract infections. So we can get viral infections, bacterial infections, just like COVID was prevalent. So these are the infective organisms which can cause respiratory tract infections. Exacerbations of your chronic diseases. So many of the people are suffering from asthma or chronic obstructive pulmonary disease, which is caused by smoking and pollution. So in those cases, you keep getting attacks, lung attacks. These are called exacerbations of these chronic diseases. Bronchitis, gastroesophageal reflux disease. So even your simple acidity can cause cough, a chronic cough, which might be very troublesome. Post-nasal drip syndrome, sometimes you just get upper respiratory tract infection, which you have cold, rhinitis. This can lead to post-nasal drip. So something keeps dripping down behind your nose, and that irritates your throat and causes chronic cough. A heart failure patient might have some swollen legs, is not able to lie down flat, and has a lot of cough while lying down flat. So this can happen in heart failure. And there are many other causes, reactive airway disease syndrome, tuberculosis, which is very common infection in India, caused by Mycobacterium tuberculosis, lung cancer, which is again very common in smoking and non-smoking population. Interstitial lung disease is something as lung fibrosis. So this is also very common post-COVID and otherwise also in females, males, it is very commonly seen. In this, the lung starts to shrink. So interstitial lung disease is lung fibrosis. Foreign body, sometimes we see kids, they come with some coin or some peanut which goes in their windpipe and they keep getting chronic cough. A chronic smoker's cough, yes, smokers sometimes have this chronic cough, they keep coughing and clearing their throat. So drugs like ACE inhibitors, pneumonia, so all these are common conditions with which patients visit a pulmonologist. So talking about the irritant-induced asthma, type of asthma that results from single exposure to a high concentration of irritant agent, or maybe a repeated exposure to moderate or low dose irritant. So this is also called reactive airway dysfunction syndrome. And you usually manage it with some nebulizations, which are bronchodilator, a nebulizer, we all know. So we give nebulized bronchodilators and steroids to these patients and they respond nicely to them. Postnasal drip syndrome, upper airway cough syndrome, is thought to be due to postnasal drip or nasal secretions flowing in your nasopharynx. So from behind, when the nasal secretions keep flowing in our throat, we have a upper airway cough syndrome. The sensation of postnasal drainage, the need to frequently clear their throat and rhinorrhea are consistent with this. Postnasal drip can be caused by simple cold, allergic rhinitis, vasomotor rhinitis, post-infectious rhinitis, rhinosinusitis, or maybe environmental irritants can lead to it. So clues on physical examination are cobblestone appearance of this pharyngeal mucosa and presence of secretions in the pharynx. So when we see patient's throat with a torch, we see a cobblestone appearance. So that tells us that this patient might be suffering from postnasal drip syndrome. The gastroesophageal reflux disease, so it is very, very common given the lifestyle, which is sedentary, stressful. So patients have heartburn, regurg, dysphagia. These are common. So although cough may be the sole presenting symptom sometimes, these patients don't feel that they have acidity or food is coming up or acid is coming up. They just have a chronic cough. Many patients with chronic cough complains of symptoms commonly associated with GERD, but 40% of patients just have cough, which is attributable to reflux. So, coming to pneumonia, we all know what is pneumonia. I'm just covering the basic diseases initially. So, coming to pneumonia, we all know pneumonia is infection of the lung. So, when infection happens in your lung, it is pneumonia. It can be bacterial, it can be viral, it can be fungal, any infection. So, patients have common symptoms of fever, high heart rate, high respiratory rate, and maybe when we do a X-ray, we can see a pneumonia patch in their X-ray. And sometimes in elderly, they don't have fever and all, they just become slightly dull. So a mental status change also can lead to pneumonia or any infection in the body. Coming to post-infectious cough. So sometimes this happens. We got a viral infection for 5 days, high fever, cough. Everything becomes fine. We are totally okay. Our energy is back. Our fever is gone, but the cough lingers on. It doesn't go. Cough is there for one month after these viral infections. This is post-viral bronchitis. Post-infectious cough refers to cough that begins during the respiratory viral infection and lingers for several weeks after the other acute symptoms have dissipated. Can happen with RSV, pertussis, COVID-19 or influenza. These are common viral infections of the lung. Coming to asthma, so we all must have heard about the disease asthma. What is exactly asthma? Asthma is a leading cause of persistent cough in adults and most commonly in children. Cough due to asthma is commonly accompanied by episodic wheezing and dyspnea. However, it can be sole manifestation of asthma, which is called as cough variant asthma. So, cough variant asthma can later progress to wheezing. Wheezing is when we have a noisy breathing in our chest. So, sometimes a asthmatic patient, when they breathe, we can hear their breathing. So, that is wheezing. And dyspnea is shortness of breath. When they walk, they feel breathless. When they do some work, they feel breathless. Thus, the best way to confirm asthma as a cause of cough is to demonstrate improvement in the cough after appropriate therapy. And therapy is again inhaled, which is either nebulized or inhalers. And diagnosis of asthma is suggested when the patient is allergic, atopic, or has a family history of asthma. So sometimes patient when gives a seasonal symptom change, like whenever it is this pollen season or October season, I have these symptoms. So this all must point us to that these could be exposures or triggers to asthma exacerbation. Coming to another important topic pertaining to your lung health, which is smoking. Smoking heavily affects your lungs. Not only lungs, it affects all your body organs, but I'm going to talk about lungs today. So, what are the hazards of smoking? Tobacco smoke poses significant hazard to health. It is linked to various cancers, not only lung but bladder, stomach, esophageal, and oral cancers. Smokers are at a risk of developing a very serious disease called as chronic obstructive pulmonary disease. So, chronic obstructive pulmonary disease is a very similar form with asthma, but the patients, it is an irreversible obstruction in their lungs. So, what damage has happened has happened. We can just halt it. We cannot reverse the damage caused by smoking. So other parts of chronic obstructive pulmonary disease are emphysema. If a patient already has asthma, then acute asthma attacks. Your lung function is severely reduced. You have fatigue, decreased stamina. Your strength becomes very less. Patients become cachexic, pneumonia, heart diseases, orodental problems, stroke, and even infertility all are linked to smoking. Passive smoking or environmental tobacco smoke is harmful. So during pregnancy, it can lead to respiratory problems, even abortion or low birth weight. If a female is exposed to passive smoke, if the husband is smoking, but the female is not smoking, but they live in the same house and she is pregnant, it can lead to problems. Children exposed to secondhand smoke in early childhood when the father is smoking are at the risk of delayed developmental milestones, growth retardation, asthma, increased susceptibility to lung infections. So it is important to highlight that sharing cigarettes, hookah, vaping devices poses a significant risk of transmitting infections. So when we go out with friends and we share hookah or vaping device, if one person has flu, then everybody develops flu. If one person has tuberculosis, he spreads the infection to everyone in the group. COVID-19, herpes. So we have to be very careful. First of all, these things should not be done. And even if you're doing, then sharing of the pipe or the device is not recommended. Coming to vaping, another new epidemic these days. So these days, people are very, very fond of vaping. They are trying to quit smoking and they start vaping. So vaping, initially it was marketed as a safer alternative to smoking, has now emerged as a significant public health problem, especially among the young people who mistakenly perceive it as a harmless and convenient method of smoking. The appeal of flavored e-liquids, sleek electronic devices has overshadowed the potential health risks associated with vaping. Both traditional cigarettes and vaping products contain nicotine and flavored liquids infused with various additives and flavoring agents. And a very common term, popcorn lung, which is a severe lung damage caused by vaping, has come up. And we have seen many cases of patients with vaping developing this popcorn lung, which is even more serious than smoking hazard. Certain additives found in vaping products are known to be genotoxins and animal carcinogens, including substances like benzoic acid, propylene glycol, diethyl carbonate, acetate, quinolone, phenol, and so on. So they are even carcinogenic. The outbreak of e-cigarette or vaping product use associated lung injury, it is called VALI, has been associated with the presence of vitamin E acetate in e-cigarettes. The additive nature of nicotine in many vaping products heightens the risk of dual addiction. So sometimes people use vapes and cigarettes both. This dual addiction poses a significant threat of lifelong dependence and experimentation among young users. Coming to hookah, which is another popular thing these days, but with the closure of hookah places, I think the thing has shifted to vaping than hookah. So, hookah, again, similarly, hookah smoking, often seen as a cultural and social pastime, carries significant health risks. This practice involves inhaling smoke from flavored tobacco through a water pipe, leading to many which believe that it is less harmful than smoking cigarettes, but it's not. However, hookah smoke is actually more hazardous than cigarettes in several ways. It contains 30 to 40 times more tar, 15 to 20 times more carbon monoxide, and 50 to 80 times more nicotine. So, how can this be less harmful than smoking a cigarette when everything is double or triple or 30, 40, 50 times than the cigarette? According to the Center of Disease Control and Prevention, the CDC, the amount of smoke inhaled during one hookah session can be 350 to 400 times greater than from a single cigarette. Importantly, the water in the hookah does not effectively filter out the toxic chemicals present in tobacco smoke, which is the usual thinking. Prolonged hookah use has been associated with respiratory diseases, cardiovascular, your heart problems, cancers. So, challenging the perception that it is benign or a safer alternative to smoking. So, it holds for both vaping and hookah. They are not at all safer alternatives. In fact, all three, the conventional cigarettes, vaping, and hookah, should not be consumed. Addressing these growing concerns required comprehensive public health campaign. Despite their perception as harmless diversions, vaping and hookah carry profound health risks. So it's not wrong on the part of public, they are being marketed as safer products. If you go on online and check for vapes and cigarettes, you get less toxic cigarettes or less harmful vaping products. So, but they are not exactly that. The marketing of these products is actually not correct. It is crucial to educate our teenagers, parents, and educators about the risk and reduce their prevalence among adolescents. Additionally, strict regulatory measures are necessary to control the marketing, sale, and distribution of vaping products and hookah, particularly to minors. Coming to pollution, now we have discussed about smoking, which was one of the major health hazards. Coming to pollution, now the winter months are approaching, and we'll again see what is the AQI and how, if we should go out or not. The vehicles will be banned, construction activities will be stopped. So, all this pollution, if we are so concerned about it, how it is affecting us? What is the harmful effect of pollution on our health? So, in order to extract 420 liters of oxygen that is crucial for human survival and function, a total of 10,000 liters of air enters the lungs every day. The World Health Organization reports that in 2012, around 7 million people died as a result of air pollution exposure, confirming that air pollution is now the world's largest single environmental health risk. So, how do we measure this air pollution? We all know that there is AQI. AQI is Air Quality Index. So, this is a method to measure your air pollution. Indicates whether the pollutant level in air may cause a health concern or not. So, whether your air is healthy or it is not healthy, it is polluted. It ranges from 0, which is least concerning, to 500. So, even 100 is okay, but when it crosses that, it becomes a concern. So this is how it is there. 0 to 50 is good, 50 to 100 is satisfactory, and then moderate poor, very poor, and severe air pollution. The measured pollutants. So there are many pollutants in the air. Air pollution is because of many harmful chemicals in the air. So which are the measured ones and the most concerning ones? So we have the 5 major pollutants: the carbon monoxide, sulfur dioxide, nitrogen dioxide, particulate matter, and ground level ozone. So, what is particulate matter? Particles of different sizes and structures that are released into the atmosphere. They are present in many sources, include fossil fuel, dust, smoke, fog, etc. Can build up in the respiratory system and aggravates heart and lung diseases, increasing the risk of respiratory infections. So, what is ground level ozone? At ground level, at upper level, ozone shields Earth from sun's harmful UV rays. Ozone is harmful pollutant formed from car, power, and chemical plant exhaust. It irritates your respiratory system, causes exacerbation of asthma, reduces lung function by inflammation, and damaging the lining of the lungs. Coming to smog, what is smog? So, smog is smoke plus fog, usually seen in winter months, which reduces the visibility and again has harmful effect on our health. So, coming to global warming, what exactly is happening? So, from the past 10, 20 years, the temperatures have, past 50 years actually, the temperatures have doubled. So that is global warming. Because of the release of harmful chemicals in our environment, the temperature is rising. The heat is getting trapped, and that is leading to numerous effects on our global health, the melting of our glaciers, the rise of diseases, and this is all because of global warming. So global warming happens because of pollution again. By release of these chemicals into our atmosphere is what is causing global warming. So we have to manage this pollution to help slow down the rate of this global warming. Then similarly, acid rain, these trapped chemicals, when rain happens, they are mixed in the rainwater, and then they come down. They damage your health, your crops, and other things. So this acid rain again is a major health problem and related to pollution. Coming to indoor air pollution. So indoor air pollution also leads to asthma attacks, chronic obstructive pulmonary disease, reduced lung function, pulmonary cancer, mesotheliomas, and pneumonias. So these are again linked to smoke, could be indoor or outdoor, but these are the respiratory diseases which are caused by pollution. Then other diseases apart from the respiratory diseases are leukemia. It is a type of blood cancer, birth defects and immune system defects. As I discussed, it is harmful for the pregnant women also. Just like smoke, it affects the baby which is growing inside and can lead to birth defects. Cardiovascular problems, your heart diseases, stroke, they increase in the winter months when there is more pollution. Neurobehavioral disorders, neurological problems, developmental deficits due to air toxins, especially mercury. Liver and other types of cancer, again, caused by breathing carcinogenic volatile chemicals, premature death. So they are all related to pollution. So this pollution not only affects your respiratory system, but all the organs which are mentioned in the figure. So air pollution. So sometimes there is a very subclinical effect when you don't have any symptoms. The level of pollution rises, the pollutant concentration keeps increasing, symptoms develop. Hospital visits are there, emergency room visits, and admission is there, and ultimately there is death. So this air pollution should not be taken lightly, should be dealt with at a public health level, at our personal level, in what we can contribute to controlling this air pollution, because ultimately it is causing a lot of damage to our own health. So small note on PFT, which is pulmonary function test. So how we measure that our lung is functioning well or not, if the pollution has affected our lung, if the smoking has affected our lung. So we all know about kidney function test, liver function test, which we routinely do. But how to measure your lung health? So lung health is measured by pulmonary function test. It is a simple blowing test in which you blow in a pipe, we get some values, and we can tell you how your lung function is. Should be performed in early smokers or people who are seeking cessation of smoking or residents of polluted areas or anyone who has asthma or respiratory symptoms and wants to get themselves checked. So now what we can do? So at our level, we definitely, the government has to intervene to check on this pollution, but from on our basis, what we can do? So ride a bike when possible, stay indoors, take electric cars, get your pollution checked of the cars, or ride the school bus or carpool if you are going to a same place. Use air purifiers. Yes, air purifiers do help. But a small note on air purifiers is because many of our patients come to our OPD and ask about it. So air purifiers are good if they have HEPA filter, first of all. They help you clear your pollutants in the air, but you should be using them according to the size. A small air purifier should not be used in a very large room because the effect will be suboptimal. Whenever the air purifier is used, your doors and windows should be closed. You should see what the manufacturer tells in what square meter room it should be used, and that room only it should be placed. Or a suitable air purifier should be purchased for your room. Then biomass fuel in cities we are not using, but in villages we do use biomass fuel as a source of to keep ourselves warm, sometimes to cook food. So that has to be avoided because it is a leading cause of chronic obstructive pulmonary disease in women. Then keep a clean environment, avoid big gatherings because it leads to a lot of respiratory infection transmission. Social distancing, like we used to do in COVID-19, and use N95 mask when outdoors. During it, N95 mask can be used for prevention of viral infections, bacterial infections, tubercular infections, as well as pollution. And avoid burning crackers this Diwali. So it is approaching. We all should either burn green crackers or not burn crackers. So measures to restrain the progression of a lung disease due to air pollution. Now we all are staying in a polluted area, and we might be having some symptoms related to pollution related lung diseases. So we should get our health checkup done. As I told you, a pulmonary function test should be done if you're symptomatic. We should use N95 mask in the pollution months. We should check the AQI before we step out of the house. So in the winter months, we all have apps in our phone to check what is the air quality index. So if the air quality index is not good, if it is more than 200 or maybe 150, we should plan to stay indoors and avoid if going outside. Our walks and all early morning, usually the AQI is on the higher side, and winter the temperature is suitable. So we can schedule our walks and all during afternoon time, or maybe when the AQI is better. Use a N95 mask. Walking with an N95 mask, we usually don't recommend, but if that is the only time you have early morning, then definitely use an N95 mask and go. And take regular vaccination, which is flu and pneumococcal vaccine for lung diseases. Now, in air pollution, we all hear this term PM 2.5. So, what is PM 2.5? PM stands for particulate matter, the term for a mixture of solid particles and liquid droplets found in the air. Some particles, such as dust, dirt, soot, smoke, are large or dark enough to be seen with the naked eye. But others are so small that can be used only using a electron microscope. So PM 2.5 refers to the particles which have a diameter of less than 2.5 micrometers, and they are about 3% the diameter of a human hair. So N95 mask is short term on N95 mask. It is a disposable N95 mask respirator. So I would like to emphasize the term disposable, because what we were doing is that we were reusing the N95 mask. So it is a single use disposable mask. It is a safety device that covers your nose and mouth and helps protect the wearer from breathing in the some hazardous substances. So N95 mask, you have to be very careful. It should not be under your nose or under your chin. It has to make a tight seal from your nose till your mouth. And how to check? Both the straps should be behind. And how to check whether the seal is tight or not? So you can do it by quickly blowing or doing like this. So if the mask blows up when you blow inside or squeezes when you take the air in, that means the seal is perfect. There's no leak. So it is designed to filter out 95% of the dust and mold in the air, hence the name N95. Use an N95 mask even if you cannot see the particles because they may be too small to see. N95 masks do not protect you against chemical vapor. So if you're working in a chemical factory or somewhere, you have to use an industry grade mask and not the N95. With carbon monoxide, gasoline, asbestos, lead, or low oxygen environments, N95 mask is not very advisable. So I already told you about the mask fit. So take the mask, put both the straps behind, make a tight seal, pinch the nose clip, and then how to check, I've already discussed. The negative pressure is when you take the breath in, and positive pressure is when you breathe out. So how to wear a N95 mask? Must cover your nose and mouth to keep you from breathing in mold and dust. If it does not have a snug fit, it will not work properly. Correct fit of the mask requires contact with smooth skin. So in cases people who have beard and all the or facial hair, then the fit might not be, then the protection is not N95 grade. It might be less. Even 1 day beard growth has been shown to let air leak in. Always use both straps of the mask to hold it in place to keep air from leaking around it. When to throw out N95 mask? As the N95 mask gets clogged, it has pores, they get clogged. It becomes more difficult to breathe. When this occurs, throw it out and use a new one. Discard the mask if it is wet, dirty on inside, if it is deformed or the filter is torn. A deformed N95 mask may not fit properly. Okay, and they cannot be cleaned, disinfected, or put in washing machine. So you have to discard them when they are dirty. So I discussed about two vaccines, flu and pneumococcal. These are the vaccines, again, which prevent you from many lung diseases and should be taken regularly. So coming to first flu vaccine, a flu vaccine is needed every season for two reasons. Because first, the body's immune response from the vaccination declines over this 1 year, and annual vaccine is needed for optimal protection. Secondly, because flu virus are constantly changing, they mutate every season, and the formulation of flu vaccine is reviewed each year and updated as needed to keep up with changing flu viruses. For the best protection, everyone 6 months and older should get vaccinated annually. So 6 months baby and older should take the flu shot every year. Only people who are allergic to egg and all should discuss with their doctors and all. But otherwise, flu shot is recommended for everyone. It takes about 2 weeks after the vaccination for antibodies to develop in the body and provide protection against influenza virus. That's why it's better to take it at the end of October, just before the beginning of your flu season. So sometimes patients also come to us that we have taken the flu shot, but since again we got flu or influenza. So this doesn't prevent you from having influenza or flu, it just makes the infection less severe. So it only prevents a serious or a complicated influenza. So people who should talk to their doctors before getting the flu shot, as I told you, those who have allergy to eggs or they have any history of a disease called as Guillain-Barré syndrome. CDC recommend, now coming to the second vaccine, the pneumococcal conjugate vaccine. So CDC recommends that all the babies and children younger to 2 years old and adults more than 65 years old, or maybe people from 2 to 64 with certain medical conditions. So it is either less than 2, more than 65 or in between 2 to 65 who are not well or have certain medical chronic conditions. So CDC recommends pneumococcal polysaccharide vaccination. So that was conjugate. This is polysaccharide. Again, all adults 65 or older, people 2 to 64 with certain medical condition, and also those who smoke cigarette. So this is all. Thank you. And now I'll be taking the questions. So I have a question from Diksha. So how to protect lungs when we have continuous pollution and exposure to AC regulated environments? So when you have continuous pollution, first of all, air purifiers should be used. When you're stepping out, check the AQI, wear a N95 mask, and avoid going out when the AQI is very high. So this is how you can help yourself. Otherwise, if you can relocate to a place where there is less pollution, you can do that. So Deepriya has a question: how to improve lung health for children? So lung health improvement can be done through various ways. First of all, the kids have to be active. The children have to play and have an outdoor time in the park. Second, the children have to have adequate diet. So diet includes vitamin C rich fruits and vegetables, and taking berries, taking walnuts. All these are known to help in your lung health. If a patient is non-vegetarian, fish and all also helps the children to have a better lung health. So keeping their immunity high, giving them the shots regularly, the vaccinations regularly, and having outdoor playtime is how you can prevent. And also don't take them to major big get-togethers where you think the chances of infection are there. So that has to be done. Kriti has a question: how to take care after severe ARDS with underlying chronic asthma. So I hope, Kriti, the ARDS has resolved now and the patient is back home. So from then onwards, you can take the regular medication of your asthma. The inhalers have to be very regular. Don't take them on SOS or on and off basis. And also, after a severe ARDS, we recommend that the patient should undergo chest physiotherapy for a good time. Some breathing exercises which we recommend. So, simple breathing exercise is take a deep breath in, hold it for 10 seconds, and then leave it. This we all were doing during COVID also, using a 3-ball device called an incentive spirometer. So if that is available, that's really good, and patient can use that, and a physiotherapist can help the patient. Take the shots, the flu shot, have a good diet, and this is how you can manage the patient after severe ARDS with a chronic asthma. So Prabhat has a question: how to cleanse the lungs in long term? So there's no way to cleanse the lungs, Prabhat, but yes, you can keep them healthy by the measures which I already mentioned. So coming to Sandeep Agarwal ji's question: what precautions one should take who has a family history of ILD, living in a place like Bangalore where there is a lot of contractions and dust pollution due to the same. So ILD, if the family history is there of ILD, first we have to see what is the reason for it. There are many reasons for ILD. ILD could be drug induced, could be genetic, could be related to some other diseases, could be smoking related. So there are many causes of ILD. First we have to see which ILD it is. If it is an ILD which is related to genetic diseases, we can do some basic tests when the patient in the family is symptomatic with respiratory diseases. And in places like Bangalore, the second part of the question, where there are a lot of construction, I hope that is construction happening, and dust and pollution due to the same. Again, use an N95 mask, avoid exposure as much as you can, use air purifiers when you are indoors, and this is how you can prevent yourselves. So Nikhil is asking what will be the changes that we can observe after quitting smoking for 1 year. So Nikhil, after quitting your smoking, your chances of getting a lung cancer, your chances of getting heart diseases due to smoking become less. And other changes, your lung function will improve slightly, but whatever damage has happened is usually there, is usually persistent. Smoking causes an irreversible damage to the lung function. But definitely a patient will have less mucus, the smoker's cough will be gone, and the chances of getting other chronic diseases because of smoking will be less. So then next question is, my mother is in her 70s and suffering from COPD. She's taking one pump inhaler daily and on oxygen and using BiPAP at night. Can she will recover with the time? So really unfortunate that the COPD patients don't recover. So if their lung function has fallen to a certain level, it remains there. But yes, definitely there are many causes which might be leading to a super added dip in such patients. Could be some infection, could be some continuous exposure. So if we can spot that and correct those things, then yes, slight improvement might be possible. But a patient will definitely be on inhalers, BiPAP, and oxygen throughout the life. So that is why smoking is really, really dangerous, and non-smoker COPD is the same with biomass smoke exposure or other air pollution leading to COPD. Then Subhaji has a question: reasons excessive and persistent coughing after taking the third dose of COVID vaccine. So COVID vaccine and cough are not related. This is a myth. And there has been no study or data which tells that if you can have severe coughing after COVID vaccine. So I don't have a comment on that. Then next question is, does smoking really affects lung? Yes, it does affect your lung. Can you show us the health issues with and without smoking with data? So if you want, you can share your email ID and we'll send you some studies, or otherwise these days so you can type in chat GPT and it will give you enough studies telling smoking related damage to your lungs. So any other questions? How to improve lung capacity for polluted and bad quality of air. So in improving lung capacity, I told you diet is important, exercise is important, avoidance of exposure is important, using N95 is important, mask, and flu vaccine has to be taken regularly. These are the 5-6 things you can do, but definitely these things are without, if you stop the exposure completely, then only the effect will happen. What exercises are best of keeping lungs healthy? So your yoga, breathing exercises, these are very good. And one exercise which we tell all our patients is take a deep breath. Sometimes, in the hustle of life, we are just not taking a deep breath in. We just because we are all sedentary, we don't need so much of oxygen. We are just sitting and working on our computers. So what happens is we just forget to take deep breath. So in your day, keep a time, some breathing exercise time in which you take a deep breath inside, hold it, leave. Do it for 10-20 times, and that will definitely help your lungs. So Sandeep says, I am a 47-year-old and have been smoking for almost 15 years till 2012 when I quit. Is there any precaution which I be taking, including vaccine or egg? Yes, you should do your pulmonary function test, Sandeep. You should be taking flu vaccine, and if something is wrong in your pulmonary function test, then definitely a pneumococcal vaccine also. Do the breathing exercises, stay away from smoking now and pollution. And it's good that you quit and you have been smoking for 15 years. Yeah. So do your pulmonary function test. Okay. Thank you. Thank you. It was wonderful answering all your queries, and hope I could help you all. So stay away from smoking, I would say again in the as a last message, because that is what you can actually do. Pollution and all, we really can't help. We can help our bit in using e-vehicles and all, but it is a major problem. But smoking is what we are responsible for, and it is directly impacting our health. So definitely stay away from smoking. Follow an active or healthy lifestyle. Have a 40 minutes routine of your some walk or exercise regime. Have a healthy diet, include berries, nuts, walnuts, your kiwi, guacamole. They all have avocados. They have a lot of antioxidants and are really good for your lung health. So you can include them. Have lots of fruits, citrus fruits and all. That is how you can help your lung. And those whoever qualify the vaccine criteria do get vaccinated. Thank you.